Take your seats and it is my privilege to introduce today's eminent speaker of session 1, Dr. Muniyanti Malai Swami Garu, Scientist E and Head of Department of Health Economics, National Institute for Research in Tuberculosis, Chennai. As a scientist and synergizing more than 22 years of health economic research, expertise and leadership, Dr. M. Muniyanti Swami Garu is heading the Department of Health Economics at the ICMR National Institute for Research in Tuberculosis in Chennai. Sir has involved in diverse social economic, behavior and epidemiological research and intervention projects in the context of improving population health. Sir has contributed as a principal investigator and co-investigator in various research projects. Sir was able to get funding from DHR, FOH, FW and established Regional Resource Center for Health Technology Assessment in India and ICMR NIRT Chennai. A study on economic evolution of standard treatment regimen of anti-tuberculosis drugs for patients with MDR-TB stream stage 2 received funds from Liverpool School of Tropical Medicine, UK. Sir has made significant scientific outputs under his working institutes in terms of documentation and dissemination of research findings. Sir has more than 130 research papers published in reputed indexed peer-reviewed journals with high impact factors. Particular interest in disease burden estimation research and previous experience in such estimation and its application to policy. To estimate the households experiencing catastrophic costs due to TB to achieve one of the NPP target of zero TB affected families facing catastrophic TB related costs, identifying costs contributing to catastrophic expenditure due to TB and develop strategies to provide financial protection to patients, health technology assessment for implementation of new technologies and strategies, TB and other diseases. TB burden amongst marginalized and vulnerable population, example, Samaria tribal population. So, with this brief introduction, today Sir is going to deliver on a comprehensive economic evaluation of innovative interventions for tuberculosis management. With this brief introduction, I invite Dr. Muniyanti Malai Swami Garu to take over the session.
Thank you, for this introduction. Hear me, I will speak. Reduce the price. So, clear? Good morning. At the outset, I thank clearly Mr. Manoj given this opportunity. I thank Principal for giving this permission to organize this program. Who am I? Yes, I'm working as a scientist. Okay, what do you need? What is the scientist will do? Good, research. So I'm not a professor who teach. I'm not here to teach something. Okay, not like your teachers. I'm not going to teach you. So I'm a scientist. How many people know ICMR? Very few other people don't know ICMR. What is ICMR? Indian Council of. What is the resource? Very good. Young minds. Young minds. What is the population in this country? 1.4 million. Is the problem or good? Good or very bad? You know, more population is good or bad? Why? Why bad? See in this. Huh? No, definitely not increase the population. Or what? Increase? Didn't get it. Increase the healthcare system. Why do we need to increase the healthcare system? No. Increase the lifespan. Not give 100 years. Don't allow companies doctor. The fear is somebody will die, so we need doctors. Somebody will die with a disease, we need medicine. We need treatment. If nobody is dying this, we don't bother about the health system. Right? The health system to protect the life, not dying before 3 things will happen. Right? We are trying to live 100 years at least. You see that Veda, Nala, Mitra, 500 years people live. We don't know how it's true. The WhatsApp message, now people live in 500 years. We don't know if it's true or not. But at least some people are able to live 100 years till today. Why not somebody is living 100? Why not somebody is living dying before that? What is the reason? We don't know. But if you think and tell me, beyond mind idea, you tell me why people are dying. So for that, Indian Council of Medical Research, there is a one big department in this country. We have a lot of departments. One is health ministry is there. Health ministry's responsibility to take care for the health. So under this all medical education, Directorate of Medical Services, many are there. One is the medical research. The research to innovate new things. How we can live more years. Maybe to control HIV, control malaria, control dengue, control COVID, tuberculosis, leprosy, so many diseases to be controlled. Again, prevent for vaccine. Sorry. Okay, for that they are working. Right? Again, government is working, private sector are also working. So what is the government? Medical research is one, medical education, you are all coming as medical education, again other industries, private sector, private medical colleges, private medical hospitals, so many are there. So one sector. The other sector is the education sector. Again, there is a link. Medical, you are all coming in the medical and education both, right? So they are interested to develop this human resources. Right? That job is very nice. Right? Then, anything, there is some money involved, that's what I want to say. Anything we initiate, money is involved. The next question to you, why you selected this workshop outside? All are students of Dr. Pharmacy. Anybody can outside here? All are students. Why you selected this course? Why you selected this course? Why not economics? Why not commerce? Why not MBBS? Why not BDS? Why not CA? Why not B computer science? Why you selected it? Why you selected this course? You tell me that why you selected this course? Next question, okay, if you are not able to answer, next question. We live maximum 75 years. Please wait. What is the retirement age in our country? 60. Why they retire? Good or bad? Why they are retiring? The life expectancy is 70, 80. They have to retire and they have to live. They can't live up to the life expectancy. What is the life expectancy? 70 years. 80. In India, what is the life expectancy? Andhra Pradesh, what is the life expectancy? So people, they can't wait to that expected life to be available. For example, how much hours you want to finish your exam? 3 hours. 3 hours. You will finish the exam until last minute of the exam. You will finish half an hour before or 15 minutes before. Then you have to check. Same like life expectancy is there. You have to retire them before they can go home and enjoy the life, right? For that only, the life expectancy you check today, what is Andhra Pradesh life expectancy? If Andhra Pradesh life expectancy is very high, if they are retiring very early, then there is a problem. They should not retire. So if life expectancy is increasing, you have to increase your working lifespan. You can't retire early. So they have to work. Like your exam, so life expectancy based retirement. Okay, the life expectancy, suppose 70, How many years? First 5 years, you are a baby at home. You enjoy. Then what next? Put them in the school. How many years you are in the school? Huh? Madam, this is 13. LKG, no, pre-KG, pre-KG, LKG, UKG, 12 years, 15 years. D-farm, D-farm, straight away D-farm. How many years? How many years you are spending for education? 13 plus 6. Mathematics, you know mathematics? 19 years, 70 minus 19. 51. Remove this 5 children. How many years remaining? Remaining 46 only you are going to enjoy. If you are searching for job and crying and not getting jobs, then my parents was asking me to marry, this, that, you, my husband is not good. What you will do? You will waste some time. Why you are wasting this, how many, 19 years, huh? Why you are wasting 19 years for education? Why? It's a waste? No waste. You sure that it's not waste and you are spending. For what? Huh? Like you enjoy this remaining 40, you are investing. You are investing your life. Anybody studied economics? There is a demand, supply, price, cost, expenditure, investment. Right? Not money, you are investing your life. Okay? Anything invested, what is the outcome? Any investment, what is the outcome? Bank, put money, what is the outcome? You will get some returns. Returns, okay? Any investment, you have to get returns. Otherwise, waste. Did you get my point? You have invested 19 years. What is the returns? How you can calculate? You have to estimate. You have to estimate. You have to calculate. You have to measure. Measure, estimate, calculate. Are you doing or you know how to do? Are you doing it or you thought to do? That's doable? Okay, leave that. Government also investing so much of money. What is the return? Whether you should know or just simply invest. We should know. There are two sectors, very difficult to estimate, calculate. Which sector? Education and health. Industry, today 10 acres land. You put paddy or cotton, whatever it is, sugarcane. Returns. This is expenditure. This is revenue. This is a profit. Easy to calculate. Education, you are investing 19 years, sir. Your parents' money, not your money. Okay, you are investing. What is the return? Marriage and sitting at home, zero returns. So you have to calculate. Now, these two sectors, so far it's very difficult to measure it because a long-term investment. Health also, somebody sick. Can we save them or allow them to die? Save, how much you have to invest to save his life? How much you can? 1 lakh, 2 lakhs, 1,000 rupees. How much? If somebody in the house fever, what you will do? Go to pharmacy, buy paracetamol, crocin, give it to them, 100 rupees maximum you can invest, right? What you will do? So everything depends on the economics. So we are investing money. Now what I am going to talk in the health sector, it's something new actually, health economics. Do you have a subject for health economics? No health economics, okay, no problem. So it's something new subject, not familiar in India, in the global also, not many people study, not many people to teach health economics also. Economics is like the concept, the price, demand and all there. You apply to this sector. Like for example, you apply the economics into the agriculture economics. Apply the economic concept to the industry, industrial economics.
If you apply this into the monetary sector, finance and all, monetary economics. So if you apply to the health, finish health economics only. So price for the drugs, price for the service, cost for the medical services, like that we have to study. Now this is a new subject, we have to measure and tell. Tell me I am a good or bad person. You don't know about me, you friend somebody, that the person is good or bad. How can you say? Suppose you tell me I am a good person or bad person. Huh? How can I say bad, good? Okay, you are making me I am a good. How can you say I am good? What basis you are saying good? How you can say I am good? I don't know the methodology how you can do that. Okay. Who is the best student in your class? Somebody will be there now, best student. How can you say that person is best? Huh? Behavior, okay, behavior. Academic marks. Then personality, then. Okay, no time, I will stop. 3. Who is giving mark for behavior? How much mark, which exam you are writing for the behavior? Who is giving mark for the personality? But it is there. But we don't know how to give marks. We don't know. But academics, we have very strong methodology. Very strong methodology. How we are doing? We are, when you are coming for interview, which one we will see? If you are coming for interview, I am from ICMR. We have a department of economics. We need some D Pharm student. We want to select. Which one is the first criteria? Which one is the first criteria? Did you see any advertisements? Anywhere? Never seen advertisements for post. What is the first criteria? Sorry? No, nobody will ask experience. I am experienced. Did you select? No, not experience. Huh? Skills, how can I test the skill? Personality, no. Huh? No. Patience level, no. In the advertisement, D Pharm first class. D Pharm first class. Finished. All will go. If 1,000 people applied, those with D Pharm first class will be eligible, others will go. So you are studying 6 years. What is the final outcome? This person is good or bad, you may be good behavior, but to fail on subject, what happened? Finished. Another one, good personality, one subject fail, what will happen? You won't get degree. Okay, marks. They are trying to measure your intelligence. They are trying to measure the intelligence. 5 mark question, 2 mark question, 1 mark question, 20 mark question. They will give different questions. Then finally they will convert into 100. Means percentage. You are all 6 years. Finally, what will come up? First class, second class, or the overall your percentage. So they are trying to measure your intelligence. 1 year not possible, 2 years not possible to measure their intelligence. They made 6 years, the final outcome will be your percentage. So like that they are trying to measure. You have to measure it in terms of quantitative. So somebody is 70 mark, what it mean? What it mean? They are good candidate. Academically good. Personality and all secondary. Then 90%. 99. Excellent, right? Somebody 50, throw them out. Right? This is like we don't know, we can't do anything. We are trying to measure it. For that, we are giving so much of importance to measure it. Now we want to measure in mathematics. Those who studied, there is an input output. I said now you come back to the subject. Investment, return on investment. Right? That's very important. Otherwise, nobody will invest. You are investing for this 19 years. It will improve your quality of this one. How you are buying saree? How you buy sarees? more females. How you will buy saree? Quality or 200, 100 rupees sarees? Good quality sarees, right? Same, we want good quality human resource, which means this is free, knowledgeable, right? The two things. This is free, knowledgeable. The whole education department, education. We have a schools, we have a college, we have so many colleges. These are all education. Medical college, hospital, these are two ministry. Health ministry and the education ministry is working and investing so much of money to improve the quality of the human resource. Okay, for that purpose we are investing. But we don't know how much it's giving returns. I buy on land, after 10 years if I sell, how much I will get it? It's double means I am getting so much of benefits. But in education, we don't know how much we are investing, whether really we are getting the returns, how we can increase the returns. Right, the two sectors, they are struggling to measure. I hope you understand how to measure your intelligence. Exam, they are make one number. The number will speak. Right, my salary is 2 lakhs per month. Somebody's salary 1000 rupees per month. What it tells? It speaks something. Right? That fellow poor. I'm rich. I have a very big, like 100 crores house. Somebody is living in the hut. Sorry, my house is 100 crores. Somebody's house is 1000 rupees. It speaks. Like somebody 99%, somebody 40% speaks. So number only speaks. Like that we need to produce numbers, then make the decision. It's a good or bad. Okay, what happened? What is your college pass? 100% pass? In your class, how many people cleared all the papers? Anybody have arrears? It indicates your class is not good. Somebody is failed. Maybe teacher is not good or college is not good. Our student is not good. 3 are there, we don't know. It speaks about that. Huh? Same thing we want to produce. In the health sector, we will try to produce number to make the decisions. I will come back to the first question, why you selected this course. This is a decision. Government also to make the decisions, whether can we invest money for this or something else. Okay, it's a decision making process, right? Decision making. All the decision based on some reasons, some evidence. Many people join this course because my father asked me to join this course. Right? My father is asking me, my senior told me to join. I don't know what evidence. Now, many colleges in Chennai, the admissions are based on what is the placement rate. 50% placement rate, oh, I need that college. 100% placement, I want to that college. Any money, I don't bother. Okay, like that we need an evidence. Evidence-based decision making. I don't know what basis you have selected this course. No need to answer now. Like that now in the health sector, need evidence to invest. Okay, so new things they are innovating because the government and institutions, why they are asking me to come and speak here? Why don't you some college professors or somebody they may be called now? Why they asking me to come and present here? Practical, okay. My responsibility, you have to innovate this young mind, new ideas you have to come up. New ideas. When you are going for interview, you have to tell something new. Then people will catch, oh, this person has some new idea at least. You know, some startups they have started. When this when inauguration, the guest speaks about something that new industries they started. I don't know whether you are able to get that point. Sometimes it's very difficult to catch up. You have to publish some paper in the set, publications, right? Then the startups, industries, something he said, no? What do you think that startups? Startups, after your course, they have a call for startups. You have to apply. They will ask your ideas. Oh, you have some ideas, they will take. Then they will help with all industries. You have to develop something new. Like a computer, they are doing like this only. Many industries, they are business people. They get some IITs and all. They are doing like that only. So the new ideas you have to. We are from the research institute. Research means you can't do the same thing. Like you have this idli maav. Idli maav is there. What are the things we can do? You do idli every day. What to do? You tell, oh my God, every day idli we don't want. Make dosa, same maav, same powder, we make dosa. And again another one. Small things, sweets, add some sweet and it will become sweet. You make all varieties, then you are innovators. Right? Same thing you have to do. That's why they are asking ICMR people to come and motivate or give some ideas so we can innovate. Then any investment have some impact. If somebody is clapping you, what you will do? You will get angry. That's impact. Right? Some impact will be there. So today they have invested this 2 days program. Some impact should be. What is that impact we are expecting? The 2 days program. What is the impact? What is the impact? What is the impact? Oh my God, what happened? You will get some idea. Right? Your knowledge will increase. Some new idea will get. So that's the impact. So today what I will do, what is economic impact? There is an impact, but I am going to talk about economic impact, then economic evaluation, how we can evaluate that. Then what is the methods available? Next one is new intervention, how we can evaluate. These things I am going to see. What you are seeing here? What is impact? The difference made. Individuals, organizations, community. Any problem? Everybody knows English, na? Any difficult word is there? Tell me what is this one? Difference made to individual organization or communities. Tell me that. Tamil there is one. Ibudiyundana Vidyartha. What is that? Where is the change? Did you get that? Somebody can tell in Telugu. What is that? Loudly. He was like this, become like this. Impact. So obesity, then he will become smart fit. Right? Then this one. These are the Kurukul. Old style of the teaching. Now modern. So there is a change. Impact. It has some impact, right? What is economic impact? What is this person? Poor fellow. Become money is flowing from the bag. Rich. So the financial effect. Financial. Another one, you selected this course, your quality of life will improve. That's the impact. Your knowledge will improve. That's the impact. You have gained more money. That's the economic impact. So health, quality of life. Education, improve your knowledge. Third will be economic impact. You have to go good job and earn money. Otherwise, economic impact will be the zero. Your quality of, if you are not getting more marks, 90, that impact less. But another one, quality of life. You be very smart. Who is coming like very nicely dressed, makeup? Otherwise, quality of life also doesn't improve. You know? Somebody is in the bus you are traveling, somebody is coming and very dirty clothes, somebody is sitting near to, what you will do? What you will do? You are traveling with bus or in the government bus. You are sitting. Next to you, somebody is coming, so dirty, very bad smell, somebody is coming and sitting next to you. What you will do? What you will do? Huh? What I will do? I will stand, I will get up and stand. Why? Quality of life is not there. Right? So quality of life should improve. That's the impact. That's it. But now, more focus. Me, see if somebody is coming to doctor. Okay, what is doctor's goal? Yes. He wants to cure, save the life. Lawyer? He may be thief, he may be crime, you can escape from that. Doctor, lawyer, engineer, mechanical, you are driving the two-wheeler. Somewhere you are stuck. What do you do? Mechanical engineer will help you. What this deformed people will do? Who will come to, patient will come to the doctor and the crime will come to the lawyer, the repair, mechanical, two-wheeler repair come to the mechanical engineer. Who will come to the deform? Huh? I don't think so. If I am sick, I won't come to the deform people. Who will come to the deform? Who will come to deform? You have to create demand. You have to create the demand. You have to think where the demand for the deform. Huh? What I want to say, like that. So what is the economist view? Now deform leave. I am economist. Who will come to the economist? Huh? Who will come to the economist? Who wants to become a rich? Economics is money. Okay. Then economist view. What is the economist view? Doctor, you said Q. Lawyer, how we can escape from this crime? Okay. Mechanical, how we can make that vehicle to run? Economist will look into that. Why we the light in the daytime? Switch off all the light, open the screen. It's a waste of money. Okay. Then all will go to under the tree. We will sit. We can give this for the rent. We will get more money under the tree. All will sit and talk. There will be money. So economists will look for everything's money. You tell me that I am coming here. It's a free. How much cost it? My time. Today I am here. It's money. How much money I spent? Flight is where I come by flight and go by flight and stay in the hotel, spend money and all money, right? What about your time? Sitting here and here. Suppose I spend 10,000 rupees coming to Chennai and doing talk and hotel. What is your cost? Money? Free? Your time is free now? Paying money to the college fees. Travel from house. All your parents' money. Okay, money. Now you tell me whether can I spend 10,000 rupees to come here and give a lecture? Why I have to do that? Whether I have taken right or wrong? Go to this Rahavendra Institute of Pharmaceutical College, give a lecture, spend 10,000 rupees minimum. Can we spend or no? It's worth or not worth? Worth or not? Waste of 10,000 rupees. Tell me, what is the impact? Tell me something. My knowledge, I know little bit health economics. How many people are there? Like one tree, how much it will produce? One paddy, how much it will produce? My knowledge will go to this many people. 10,000 is nothing, right? 10,000 is nothing. These many people, my knowledge is gone to so many people. It's very cost effective information, right? So that is the impact, economic impact, right? Can you go next slide? Why it's not moving? Stuck? So like that, what we are doing, we are trying to measure it. Like the education how we are doing in the health sector. Oh, then if you know what is the impact, what is the economic impact, if doctor is doing, it's medical impact. Pharmacy is doing, pharmaceutical impact. Education impact. What I am doing, economic impact. Right? So now how we can do the analysis. In the statistics mathematics, now how you will do? You have to estimate 3 plus 4. 3 plus 4 is analysis, right? You are calculating. It's analysis only. If you go for a plus b whole square, a square plus b square, analysis. It's all analysis only. Don't say that simple nothing, very big only analysis. It's analysis only, right? If somebody is testing the blood, what happens? lab technician taken blood, analyze the things and given result. Don't say that it will go to the computer, it will do all the analysis, then only the analysis. Anything will be the analysis. So if we want to do the economic impact analysis, what we have to do? Examine the effect, any event. Now we are conducting the workshop program, this is an event. This event, if you want to measure the economic impact, it's an economic impact evaluation, right? I will go a little fast. Measure or estimate, I already mentioned that. We have to measure it, otherwise it's a waste. Then, in the COVID time, they have measured. I will skip all these things. When we do the economic impact evaluation, your education also, how it will give impact. You know that in the intervention, we already mentioned that intervention. Intervention is the action or process of intervening, action taken to improve medical disorder. This pharmaceutical things, anything to improve the health or produce some health, any event, any action become the intervention. Prevent the disease, anything will be the intervention. Then that produce impact means produced by the intervention. Like suppose you are coming by the walk, you are coming by two-wheeler. Two-wheeler is an intervention. Okay, then that will give some impact, right? What impact it will give? Reduce the time. So something like that impact, that event produce the impact. How that will produce, you have to take into consideration, it will be positive and negative, right? Then another one, intended and unintended, I will explain what it is. Direct and indirect, primary and secondary. These are the different types of interventions. Other things I hope you know, what is intended and unintended. So other things you know now, primary, secondary, direct, indirect. Direct means I am spending 10,000 rupees directly for this coming here. What about my indirect cost? I traveled the whole night by the bus. I am so tired. Huh? Okay. Then I didn't like this food. What happened? These are all indirect. Okay. What is intended and unintended? How many people have mobiles? Nobody. Mobile. I hope everybody have a mobile. If there is no mobile, means something problem. Everybody have a mobile, na? Yes. Mobile. How many people have a smartphone? Huh? No smartphone. All are have smartphone. How many people are smart here? Smart? You are all smart or not smart? Huh? Can you give some example how you are smart man? In the inauguration, you are all sitting, teachers are standing and watching. You made teachers to stand and watch. Some sound is wow. Some sound also coming behind this. You are all very smart. Not smart, you are all very smart. Okay, then you be smart. So these are the intended, unintended. This mobile, what happened? The previous is to communicate. In the village, people will go by walk to communicate, right? Then they have a cycle to communicate. Then letter. Then sorry, telephones, the landline phones. Then sorry, what is that? I don't know. Keyboard. Keypad. Oh, I don't know. Now this mobile. Suppose I am giving some example. I don't know in Andhra Pradesh. In the village, some deaf. How they will communicate? Huh? Today mobile. In the olden time, somebody without shirt, they will go with a towel. People will ask what happened. That's an indication. Oh, somebody died. They can't tell also. It's like we have a ethical, emotional, all the things. Somebody is going with a towel. People ask what happened when somebody died. That's an indication. Then people will go and communicate cycle. Today, mobile, 1 minute spread. This communication field changed drastically. The impact for communication by mobile changed drastically. Not only in the communication sector, that is the intended benefits. What we thought is communication should go very fast. So immediately ambulance you can call. You can send messages in the abroad and all, it will take 1 month to reach one letter. But today, next second you can send by the mail. The communication sector has changed drastically. This communication sector also pass on to the another sector. This sector, I am standing here as economist, I will become the medical person, I will become the pharmacist, I will become the educationist. Like that, what mobile is doing. How many people have a camera in your home, or how many people have a camera? Anybody have a camera? Huh? Very few. Why you need camera? Mobile. If you have a mobile, why you need a camera? Mobile have a more advanced this and with pics and all that. Then other one, post office. How many people send in the letters to your relatives? Nobody. It will throw the post office, it's thrown the camera. Next one. How many people watching TV? TV? Very few. You know, because what happened in the house, you will change the channel. Your father will come. What you are watching? I want to see the news. The remote, damar. Finished. Then fine. Now you are watching, okay, I will go to my mobile. Whatever I want, I can watch. It will throw television also. Like that, what is intended from the mobile? What is intended from the mobile? Communication. But unintended, post office is gone, and now again another unintended, what is that? People are saying cancer is coming up. Cancer is coming up. Then behavior change. Somebody said behavior change. Nobody is talking to the people. They are always watching the mobile. They will forget how to talk. You need one skill. The human being have a communication skill. How we can communicate? In the very smart, attractive, articulation. Huh? That is one. If I ask somebody to speak, can you speak about little about tuberculosis or about pharmaceutical things? Somebody can speak 2 minutes about your deformed. Can you speak? Can you speak? Can you speak? Can you speak? Nobody. Why? Why people are not come forward? You don't know how to speak, or so this unintended consequences, right? When you are introducing some health interventions, we have to be very careful. Your unintended consequences also will be there. If it's for example, somebody have a cardiac problem, so there is a new instrument, some new innovation is coming. Then you say it's very beneficial. Then you can introduce. We have to carefully think unintended, particularly these pharmaceutical companies. Pharmaceutical companies producing more drugs. We need to produce more drugs, no doubt about it. But when you are introducing, you have to think about the unintended consequences very carefully. Okay? Next one. Then these are the some example, pictorial examples, how poverty and disease impact the economic development of the country, right? Individual. If somebody have a disease, they can't go for work, they will sick at the bedridden at home, it's a disability, it causes they are not able to go for work, they lose their income, then they can't eat properly, they won't get income, then they will fall into the poverty. It will circulate and accumulate, it will pass on to the next generation. It is an impact. For example, I am saying. The next one will be, this was estimated in this country. In the country, how much lose because of the tuberculosis. Right? So much of 13,000 crores per year lost because of people are getting TB. TB is curable, but still, if somebody is getting disease, it's a loss to the country. Women, that is the economic impact. Social impact, stigmatized disease, because infectious, it will spread to the others. People are so scared. Somebody is getting disease, they will throw them out, or female very difficult to marry. It's a social disease. And again, if only one member, earning member in the house, if he is not able to go for work and he is not able to earn, then children will be stopped from the school. They will send them for the work. They have to earn and to manage the house. It is like another unintended consequences due to economic problems. Next, then economic evaluation. Economic evaluation. Previously, you don't have a choice. Okay, now what happened? Lot of choices. Previously, what is the choice? People will come with this one, dress. Lot of choice today, right? Medicines, lot of choice. Diagnostic, lot of choice. Education, choice. If there is no choice, only one school in the whole district, what you will do? Everybody will go to that school. Only D form is available. No choice. But when you have a choice, your responsibility you have to produce more choice to the people. Then people can select it, which is the best. Now we have a lot of choices. Then we select which one will be the better. How you can select? Again, my first question: why you selected this? You have a lot of other choices. That should be some evidence. But you, no problem. If government is selected one, you have a right to ask how you selected this one. Why you selected this one? Now people are asking now COVID vaccine. Why people selected this? Why? Is that right? 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 COVID vaccine for everybody is right or wrong? Huh? Wrong. Right? We can ask government to answer. Okay, that time people are dying because spread is very fast. People are dying. No other way. That's the only choice we have to implement it. Right? That's the choice. So if you have a choice, then COVID, Covaxin, you have a choice. Then they ask which one you want to take it. So this economic evaluation is a comparative. There is no choice, nothing. Economic evaluation, you can't do that. If you have a choice, you can select which one is best. But economic evaluation is comparative analysis. If you have a choice, you can compare. It may be one or more than one also, you can do that. Why we need to do that? Why we need to do this economic evaluation? So technical skill. Okay. How doctor will start the treatment? Tell me that what's the time? Oh my God, okay. I have to go a little faster. How doctor will start the treatment? I will finish it. Okay, tell me how doctor will start the treatment. You may be seeing now people, anybody sick, they will go to the hospital. How they start the treatment? He says diagnosis. Diagnosis means based on diagnosis, they have to start the treatment. Okay, who will do the diagnosis? Huh? Doctor. This is saying doctor. Any other? Radiologist. Anybody? Huh? Sorry? I'm not able to hear. Technicians. Radiologist, technician, lab technician will do the test. He will give the result to the doctor. Doctor can start the treatment. Right? Who is these people? Technicians. Technicians do the technical work, give the result to the doctor, then only doctor can start the treatment. Otherwise, not possible. Right? Okay? Technicians are important or not important? Very important. If technician is not given result, doctor can't start the treatment. Right? Now, I am saying this one is a technical skill. Technical skill. You have to provide the result, then people can take the decision. Okay? This economic evaluation is a technical skill. In other words, we can say the tool. I want to remove the screw. I want to remove that screw. How can I remove? Huh? Without screwdriver, can I remove? Why not? I can try with my hand now. Huh? What happened? Can I do it with my hand and remove that screw? Somebody said yes, sir. Can you do it? Who said yes? Can you remove that screw? It's a very difficult or simple task. Huh? Simple or difficult? Huh? Huh? We can't do it in hand. Right? Screwdriver, if we have a screwdriver, very easy. So we need a tool. So all we are studying, you are all like a technicians, helping for somebody. Carpenter. Somebody made welding and they made this tool to sit comfortably. Somebody made this stand and keep that mobile comfortably. somebody made this LD, LCD, all the tools are developed. So you people also, you have to identify after my lecture, not now. You are all going to use the tool for this purpose, the form. You identify what are the tools you learned. Okay, if you don't know what is the tool, there are tools for everywhere. Mathematical tools, statistical tools, economic tools, medical tools, all we are learning the tools, we are the technicians. We have to produce the results to make the decision, right? So this is a one tool. How this screwdriver will help very easily, otherwise impossible to do that. I can't remove the screw without screwdriver, right? So this is a tool, we are the technician to produce the result, help the person to make the decision. Okay, economic evaluation is a tool. You identify in the D form what are the tools you are learning. I will come to that what is the tool in economics, right? There are 4 types of economic evaluation. These are the, see, you may be studied input output, right? Input output you study now, left hand side, input output, what else? Cost and benefit, something like that. So these are the, in health economics, there are 5 types. Health, it's very difficult to measure the outcome. So if you do only costing, it's a costing studies. If you do cost and effect in terms of clinical outcomes, based on the outcome, the name will change. For example, same idli maavu, you make idli. What is the name? Same maavu you make dosa. I don't know, whatever name is changing based on outcome, right? Here, if you do only maavu, that's maavu, powder only. Make idli, same thing like your outcome. If you are doing clinical outcome, for example, if you want to cure somebody, what is the cost to cure TB, cost to cure malaria, cost to cure COVID? That is the clinical outcome. That is the cost effect, right? Next one, utility. What is the utility? Utility is studied. Anybody studied utility? Utility means satisfaction. Okay, if you cure, what is the satisfaction? You live more years, improve the quality of life. You multiply with this 2, you will get the quality adjusted life years. You are driving the vehicle, they will repair, you are repair it and drive it. So you are adjusting the quality and adjusting the life. So quality adjusted life years. If you no treatment, you will die. So with the treatment, you are adjusting your life, you are running. So it's a quality adjusted life years. That is the indicator. So utility. If you are investing money, input also money, output also money, it's a cost benefit analysis. Okay, based on the outcome, the name will change. Okay, if you do only costing, then cost effect and cost utility is. Then what are the clinical outcome effect? Cure rate. I already mentioned cure rate, life saved. Suppose premature mortality, if you are able to avoid with the treatment or medicine, it's a life saved. Life years gained. How many years you are gained with the treatment? Quality adjusted life years, disability adjusted life years, years lived with years of life lost, years of potential life lost. What is the potential life? There are 2 important in our life. What is the 2 important? One, you have to earn money. That is the economically productive segment of the population. 15 to 60, whatever you said, retirement. That is economically productive age group. It's very potential. You have to earn. Another one, not health. You have to reproduce human resource. You have to reproduce. Reproductive segment of the population. It's very important. If somebody dying, that part is a loss, potential years of life loss. These are all you make your own. This is not the standard. It's a very normal term only, na? Or it's very difficult. So like that you can make. Then another one, death and mortality to be avoided. Then this is the formula. Okay, what is sex ratio? Sex ratio, anybody studied? Sex ratio means what? Ratio, right? How many males, how many females are there? If sex ratio is imbalanced, what it tells that number? If sex ratio is imbalanced, very difficult to get married. 1000 males, only 500 females, na? Very difficult to get married. So that sex ratio should be equal. So that's the problem. Same thing, the ratio will tell how many males, how many females. Here, if you want to produce one cure, how much you have to spend? That ratio. If you want to reduce one mortality, how much you have to spend? That ratio. Okay, that's incremental cost effectiveness ratio. Now you know cost, you know effect, right? Effect. Now it's a ratio of incremental cost effectiveness. Incremental means somebody is working in the office. They say my increment is coming next year. What it means? That's additional income, right? That's the increment. This is the additional cost to get additional effect. Like now you are doing 1 degree, you want to do another degree. What happened? That's incremental cost to get another degree, right? Clear? This is the formula. What it tells, this is the tool actually. Economic evaluation is a tool. You have to collect cost, you have to collect effect, you have to estimate incremental cost, incremental effect. You will get some value. You will get some value here. This value, you have to figure it in this. What is this one? You know graph, na? 10th, 9th, you made graph. What is this one? This is a plus, this is a plus, this is minus, this is minus, right? If some number is coming here, what it means? Positive. Or some number is coming here means plus plus, right? Plus plus. Some number is coming here plus minus. Here minus minus. Here minus plus. Now I am coming. This is the cost. Cost. This is the effect. You can say benefit. Whatever you can say utility or effect or anything you can say. This is the outcome. Right? This is the cost. You tell me some number is coming here. What will happen? What is this? It will tell. More, it is written here. More cost, more effect. Coming here. This is effect, na? This is the cost. Less cost, more effect. Here, less cost, less effect. Here, less effect, more cost. Very good. Now you tell me, you are investing money. You are purchasing something less cost, less cost, more effect. What will happen? Definitely it's beneficial, right? Less cost, more benefit. Suppose more cost, less benefit. Reject. Okay, next one. Less cost, less effect, more cost, more effect. So complicated. Now the decisions are less cost, less effect. Because we don't bother about the effect. Because less cost, less effect. We want to move to more effective. We want more effect. More cost, more effective. Then question, how much more you want to invest. Why you are coming to pharmacy? D-Pharm? Definitely it's more effect. Right? Why people are going for MBBS and spending crores of money? More effect. But how much you can spend? Government college this much, private college this much. It's based on their willingness, their ability to pay. Now you tell me how marriages are fixed here in this country. Marriage, how marriages are fixed? How marriages are fixed? Who fixed the marriage? How they fix? Based on? I don't think so. Your parents will not give some alcohol addict earning more money. Your parents? No. Then? Astrology. Not matching means you can't marry. Astrology. Same like astrology, this is the decision. Astrology, you know this small boxes, na? Oh, it's not matching. Throw it. Same like here, it will tell this is accept. This one reject. Right? Sometimes they will say not do some puja, match. Same thing, right? Same astrology kind of. So if more cost, more effect means You have to decide based on the country's per capita income. If you are increasing one life, again, if somebody is getting pension, what they will do? They will try to save his life. Somebody is no pension, allow them to die, right? Same thing like, so if you are increasing life with a per capita income, less than per capita income, is very cost effective, you can invest. You don't think that economists will think more money, but it is some threshold point, like what is the pass mark there? What is the pass mark? What is the pass mark for your exam? Same thing comes threshold, right? Next one, when we have to do this analysis to see the affordability. Affordability means, can we spend marriage for 100 crores? Why? We can't afford, right? Same the government also. Affordability. If you want affordability, you have to do the costing studies. Right? Next one, sustainability. Okay, still your father have a 100 crores. Then with 100 crores in the bank, what you will do? Spend 100 crores and next day you will stand at the road. So your 100 crore also we can't spend. We need money for future. Yes, sustainability. Next one, impact of the disease. Like epidemiological disease going up or down, then we have to investigate on that. Then value for money. You have to check 1 rupee today's values, how much for next 10 years. Value for money. That will give the full economic evaluation. Another one, price setting. Price setting. If you how this sarees and all they are fixing. They have to fix the price based on their production cost and benefit. So fixing the price is simply I will skip up. Then studies on economic. Now I will come to the practical. How many people, how TB is diagnosed? This again I am coming to the TB diagnosed. Pick up time. How TB is diagnosed? Tuberculosis, how many people knows TB? He is saying the tuberculin skin test. Okay, CBNAC. Okay. That is not the diagnosis for TB. That will give, see, TB is an infectious disease. The bacteria is there in the air. Those who are all breathing, risk. Risk means they have some consequences in future. So the bacteria will go into our body. Our body has so many weapons inside. It will clean the bacteria. It will clean the bacteria. So sometimes this bacteria will stay somewhere. Bacteria stay, it won't give harm at all. But when you are weak, then bacteria start multiplying. Then it will give the problems. When the bacteria multiplies, then your body temperature will change and your body weight will change and you will get other complicated cough, you will get, all will come. So otherwise bacteria is there, maximum people in our, those who are all breathing, then when you breathe bacteria, it is there inside. Sometimes your body has a very strong immune system, it will clean it, otherwise bacteria will be there inside it. To test bacteria is there or not, this is the test. Okay, this tuberculin test will tell, but all these people bacteria will not the disease. Disease, when the disease will come, bacteria multiplies and it create a problem. Otherwise we never bother about that. Right? Now for the elimination, other countries they start cleaning the body. So in your body bacteria is there, take some medicines, clean the body. But it's very difficult to clean also. Again, how we can test, how long you have to take the treatment. Again, you breathe, bacteria will go inside. These are all unnecessary, we never treat this one. But the people will say that you have bacteria, be careful. Okay, if any problem you come immediately because you have already bacteria inside. So this test we are not done so far. Because again we have a vaccination, we have protective bacteria inside, that will also give positivity, again false positivity will give. So now there is a new test, CyTB. This test will differentiate whether protective bacteria or TB creating bacteria. Now we are aiming, we can try to clean it bacteria for 6 months time so that we can prevent the TB. We don't have other preventive measures. Okay, only the BCG vaccination is there, it's for the birth. No other interventions. Can we go with this test and those who have a harmful bacteria, can we clean it? So can we introduce this test? So government how much needs to invest? This is what we have done it. So we have collected data. This is like we are trying to evaluate cost effectiveness of CyTB. That bacteria is there or not, the name is latent TB infection. You have infection, latent, it is there, it won't happen. So to test the latent TB, Then what is the cost and effectiveness of implementing? Can the government can implement it? That's the first thing. Then we have done, this is like a model-based study. Model means analysis. We used decision tree. Decision tree is a flowchart kind of things. What is the input, what is the outcome? I will show you the decision tree we used, and the perspective is there. Perspective means health system how much is spent, patient how much is spent, or insurance company how much is spent. That perspective will be different. We focus on the health system perspective, and who. If you introduce for only household contacts of TB, not for everybody. Everybody is very expensive. We don't want to do it for everybody. Somebody have a TB in their house. In their household, it can be screened and do the treatment. Household contacts the population. Intervention. What is new? Site TB. Old one is what is that tuberculosis skin test, which is not useful at all. Then again, we want to find out if you introduce the site TB versus true positive, true negative, all these things we measured. And we collected data from the secondary source. This is the decision tree model. I am sorry you are not able to read. Like this is a test. They have positive. There are true positive and false positive. Then finally prevent TB. That's the final outcome. So to prevent one TB, which will be the best, what is the cost to be invested? That's what we tried. So now these are all input parameters. See how you can make chili powder. Sambar powder. How you can make who's good in cooking? Tell me that how we make sambar powder. Only chili and the basic powder? Huh? Spices you have to add. What are the things needs to be added? Who knows? Huh? What are the things, sir? Chili. What is it? Chekka, I don't know what is that. Coriander. This. And all masala you have to add. That is the input, right? Sambar powder ka input. Okay. What will come outcome? Very good. Finished. This is the model input, right? Model input. These are the cost parameter. We have both sides now. This side cost, this side outcome. So this is the input for model. Okay. Output parameter again you have to add. Then model outcome will be what it will come. Total cost, total effect, incremental cost, incremental. These are the model outcome like sambar powder. You have to add input cost, input effect. Then model will give total cost, incremental cost, all it will give. Total effect, incremental effect. Then what to next? How you can calculate ISER? Cost difference divided by effectiveness difference. You have to see the ratio. Then it will give some number. You can put it that graph na. It's a plane actually. Cost effectiveness plane. You put it, then easy to make the decision. So put all this input and get the output. Calculate ISER. Then you can easy to make the decision. Sorry, it's not moving. Next slide. Little fast. Tell me any doubts, any clarification. So what I want to say, when you are, this is now the government of India made this, one is ICMR, another one is the Department of Health Research. They made another health ministry. They have different departments. Previously it was ICMR is one, TBT, medical college, DME, so many things are there. But for the research, they made one Department of Health Research. In the government of India, they made Department of Health Research. They are made one health technology assessment, which means so many health technologies are coming. We have to evaluate and tell the government which one can be. Not necessary government, private college, everywhere. They have to implement it. Okay, for that, this is a very important tool to assess, tell them whether they have to do it or not. So, in that, all companies are now coming. They have another one, innovators meet. Innovator means all pharmaceutical companies. Pharmaceutical companies are coming with new innovations. They ask whether it's cost effective, whether they have done the economic evaluation. So now this company demand people to do this skill. Did you get my point? The pharmaceutical companies need somebody to do this analysis. If you are able to do this analysis, at least when you are going for companies, you tell, I know that economic evaluation, I know this health technology assessment, so ICER I can calculate. ICER what are the input we need, what it ICER, what it tells. If you are able to tell, that's a new skill, help you to get the jobs. What is the ICER value? 18,658. It means if you prevent one TB, you need to spend 18,658. Where it will come? You have a plus minus. This is plus. Like there only it will come. Huh? Okay, means more cost, more effective. Where it will come? This is this part. This part is more cost, more effective. Then another one, to make sure that your answer is right. Suppose you put so much of this masala, so much of chili, what will happen? Spicy. So if you change your combination, your result will change. Suppose we put all the cost. If some cost is changing, means your result will change. Okay, you make sure that whatever cost some range is changed, your result will not change. You have to make sure that our results are pakka. Then for that you have to produce this ICER values for so many times. Like 1,000 times you produce ICERs, then it's coming how many times? 55% of iterations, or only 55%. Means what? There is a risk your result will change. Another what percentage? 45 for remaining 55%, you will get the same result, more cost, more effective. Remaining 45, your result will change. These are all little technique. I know that for you it's a little difficult. Then this was published in the journal, and this government is already policy. Policy means we have a recommendation to the government to implement it. Government is implemented. Now site TB is there in the government to test. You said tuberculin, now somebody said tuberculin. No more tuberculin now. There is a site TB. Government changed that tool, right? Right. Then next one. What is this one? Somebody to read loudly. Who is good in reading? Oh my God. Why you are so scared? Read. Who is good in reading? Okay, I will read then. Okay. Cost effectiveness analysis of the new regimen. You know regimen, na? B is a bedaquiline, presinamide, all this combination of drugs to treat MDR TB. MDR, you know, na? There is a drugs to treat TB. If the drugs are not working, the resistance TB. If it's coming more than one drug is a resistance, multi-drug resistance TB, very difficult to treat, right? There is a regimen, new bedaquiline containing regimen. Again, previously it was like 24 months treatment, 11 months treatment, now 6 months treatment is there because of what? The pharmaceutical companies innovated new drugs, we are able to reduce the duration of the treatment, right? You are all in this sector, you should know, right? With TB drugs, then we want to see that whether the 6 months regimen is good compared to the bedaquiline containing regimens. When we used another one is a previous study we used the decision tree. It's a Markov model. Markov model is a regimen with outcomes, right? Outcomes. What are the outcomes? Last follow-up, they are not able to complete the treatment. Cure, failure, regimen they completed but still not cured. And the relapse, they cured again they got TB. Second time, these are the outcomes, we consider all these outcomes, and these are the input. These are the model outcome will be the same. What is this ICER? Summary measure of economic evaluation. All model will produce ICER value. What is this ICER? Remember this astrology table. Like this one is a astrology table. Right? So this ICER value, what is this one? We are comparing two regimens. One is a BPAL M, so modified, BPAL modified. It's a BPAL, which means it's a bedaquiline containing regimen. Bedaquiline drugs, you know, na? Bedaquiline containing regimen. This is a standard regimen. So this ICER is 376 minus 2329. Tell me what is this indicates. This is the number we produced. So what is this number? 376 means plus. Which one is less effective, more cost? 376, what is this? less cost. Okay, this is 375. This one's a default rate as compared to the mixed. So the ISR value is 376 means very good. More cost, more effective. Plus, there are two plus will come. More cost, more effective. Less cost, less effective. What is the controversy? Less cost, more effective. More cost, less effective. Right? You have to be very careful. Then this one, this is more cost, more effective. To produce one cure, you have to spend additionally 376 rupees. The next one, minus means, here the cost value is there. Less cost, more effective. It means definitely it's a very saving, cost saving, like less cost, more effective. So then we have to put it in this diagram. Where it's coming? This is a more cost, more effective. This is less cost, more effective. It's a good one. You can accept, right? Then you have to produce more times whether itself will change or not. It's not changing much, but still there are here only more cost, more effective or less cost, more effective. Then still with the risk again here for 61% more effective. So it's a good number. These are the policy. What happened is somebody to read. Union Health Ministry approves the introduction of new shorter, more efficacious treatment to treat MDR TB treatment. Right? Previously 24 months, 11 months. Now government introduced 6 months based on this analysis. Otherwise government will not implement it. Government doesn't know whether it can be implemented or not, how much money is worth investing. Otherwise they don't want waste money. You have to provide the evidence, then government can implement it. That's what we are doing. So to summarize, economic, I am not going to read all these things. Now, tell me that what is that you produce more numbers, make sure that it's more effective. Anybody trying for IAS? No? How many will complete your degree in 6 months and go without arrears? How many people? Nobody. How many people will complete the degree and go out in the 6th year? Huh? Only these people. Why? What happened? What's the problem for others? Huh? Huh? Arrears. Second, doesn't matter. 6th year, whether you finish your degree or not. Yes. What is the chance for that? What is the chance? What is the chance I will go back to Chennai? When I go back to Chennai or not? I am going to stay here. What is the chance? 100% I will go home. What the chance you will go home? 100%. What is the chance you will finish the degree in 6th year? It should be 100. Don't less than now means arrears. 100%. You have to aim for 100%. If somebody is trying for IAS, cricket, what is the chance? 6 for all the wickets, all the balls, 6. Impossible. Very less chance. 10%, 20%. Like that, you have to increase your chances. For that, if you want to become IAS, what is the chance? I am asking, if somebody wants to become IAS, what is the chance? 0? No 0. You are not applying means 0. You apply, what is the chance? Some chance will be there. 10%. If somebody is applying 50% chance, how you can increase your chances? You have to go to coaching center, you have to study and all these things. If suppose somebody very difficult for in the plus 2 mathematics, they are going to fail. What is the probability for fail is very high. How you can increase the chance? You have to go to tuition, you have to practice again and again mathematics, the chance will increase. Like that is the chance actually. You have to increase the chance, become the more cost, less cost, or you have to increase the, how you can, if somebody pharmaceutical company give a drugs, if it's a more cost, then you have to discuss with the pharmaceutical company, review the price, then it will turn into the less cost more effective. Then you can identify which cost is contributing to become the more cost, then you can adjust. All these things are happening in the industries. Right? If you are able to do these techniques, if you are able to make more profit for the company, what will happen? if you are able to give your idea, this analytical skills, if you are able to produce the evidence, that company will become more profitable, and you are giving the chance also. You are increasing the chance 100% is beneficial. 100% you will get the profit. What will happen to the company? They will take you how much salary you want. Stay here, give you the idea of how I can increase the profit. Right? So this skill is useful or not? Thank you. Any doubts and clarification? I'm happy to answer. Thank you. I think. Sorry, I finished. Thank you. Thank you so much.
Now the session is open for queries. Dear delegates, do you have any queries? Please you can ask.
Good afternoon, sir. Is there any limitation of these studies, sir?
So this question is any limitation. Any limitation. What is the limitation? Masala powder, chili powder. You are putting input from the data. Your input is wrong or there is a error. Your result is error. So we have to be very careful for the input. That is the one. Another one, to avoid this one, you see, suppose your cost is vary. Then you have to see the chance to get the same result. For example, you are saying this medicine is very useful. It's very cost effective. What is the chance to this result become changed into the other more cost, more less effective? What is the chance? That way you can make sure that the chances are less for the errors. No, another question is sample size. This is not based on the samples. We need summary measures. What is the cost component, human resource, medicine, other whatever component is there, all component costs we need, and the effect also, it may be cure rate and survival probability. And again, for example, TB, we need what is the cure, what is the default, what is the death, loss to follow, all information we need. And relapse is very important when we are introducing new regimen. See, did you understand this question? Something new TB regimen. TB is curable. What is the problem? Some regimen, if you suppose 1 month you can cure the TB. What we need to look into that? Relapse. 1 month you cure, then another 6 months you come back, then it will be very expensive again to treat. The very important when we are introducing new regimen, relapse. It should not come back again. That is a very important part when we do the TB model. Next. Any other questions? If no other questions, thank you. All the best for all the students.
Thank you, sir. Thank you for sharing your valuable information. The session is so informative on economic evaluation and evaluation of cost effective of site TB screening in India, latent TB infection evaluation and methodology, discussion 3, concept of loss and more effective concept, ICR for TB prevention, etc. Thank you so much, sir. Now, now we have the lunch break. Dear delegates, you can go for the lunch and have the lunch, and you have again gathered here by 1:50. Please, we have very less time. Please cooperate with us.